बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लल्लाहु अलैहि। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This is female, almost 27-year age, with history of fever, pain and tenderness at the right iliac fossa region. She also gives history of feeling of mass-like structure at the right iliac fossa region. Also, she gives history of same complaint for the last 15 days. Then with the medicine she recovers for a few days. Then again she developed such pain. Now the current history is for the last 3 days. So I'm going to scan the right iliac fossa region, suspecting acute appendicitis. I'm now right hypochondrial region, and I'm again going downward, and this is the cecum. I'm now at the right lower quadrant, and we can appreciate this is the cecum, and here we can appreciate the complex mass-like structure that is containing debris fluid collection. We can appreciate the fluid with internal coarse echoes, and this is the small bowel ileum, and this is the fatty tissue which is inflamed. This is the fatty tissue, and here we can appreciate the gas filled bowel which is surrounding this complex mass. And here we can appreciate this is the appendix. We can measure it. Appendix is 6.6 millimeter. So here we can appreciate that this appendix is inflamed, and it is surrounded by the debris fluid collection, multiple bowel loops, small bowel, likely ileum, and the fatty tissue which is greater momentum, giving the mass-like structure. So I'm going to put the color. We can see the vascularity at the periphery of the mass, and also the vascularity is present in the surrounding of the appendix also. Now I have seen its blood picture. There is also leukocytosis. Look here, this is the appendix. This one, this, and in this here at the right side it is not properly visualized. I can't appreciate it I'm unable to appreciate further, only it is visible at this area. And from this area we can appreciate the fluid, debrinous fluid, and this one, which is, there are different pockets of fluid which are interconnected with each other. So in my opinion, when we appreciate the, if we look at the history, if we also consider the history 15 days back, pain and tenderness in the right iliac fossa that was relieved by the medication, then again it developed for the last 3 days. History is pain, tenderness, feeling of mass, fever. So this history suggests that the patient developed the appendicitis. This is the appendix, and then gradually the gut loop and the omentum surround the appendix, making a mass, and then further it is complicated to the thick debrinous fluid formation. So likely, in my opinion, most likely I would like to suggest this is the complex acute appendicitis with periappendiceal inflammatory mass and early developing appendicular abscess formation. So this was the, I am going to show you the picture and sonographic findings of such a pathological process, how the appendicitis with periappendiceal mass that is inflammatory and the development of abscess, appendicular abscess, can have in such kind of picture when we scan the patient. Again, we can appreciate, again you can kindly observe this condition. This is the appendix, and this is the thick debrinous fluid collection, multiple pockets interconnected with each other, and this is the small bowel, and this is the omentum surrounding it. Also the fat is also inflamed, and here are the gut loops which are surrounding and giving the mass-like picture. Thank you very much.